Hi lovelies, today we are talking about two diseases, same name, completely different problem. Today we are breaking down diabetes mellitus and diabetes insipidus so you do not get confused with them again. What is diabetes mellitus? This is a disorder where the body has a problem with insulin. And somebody might ask, what is insulin or what is the job of insulin? The simple job of insulin is to move glucose from the blood into the cells. If this mechanism is break, that means that our glucose stays in the blood. It doesn't get moved into the cells for energy to happen. Blood glucose rises, cells do not get energy. And under this type of diabetes, we could have type 1 diabetes, which means there is absolute no insulin production at all due to a problem with the islet of the pancreas. We have type 2 diabetes, which is caused by insulin resistance or deficiency due to lifestyle, such as obesity, sedentary lifestyle, smoking, alcohol, and all that. And we have gestational diabetes. Gestational diabetes happens during pregnancy when there is like hormone changes. Classic symptoms that we're going to see among this type of diabetes, which is mellitus, is going to be our 3 Ps. And what are our 3 Ps? That is polyuria, that is frequent urination. We have our polydipsia, that is excessive thirst, and polyphagia, which is excessive hunger. I want to explain one simple thing here, why there is so much P in this situation. It's because the high concentration of sugar in the blood is going to pull water with it into the urine. And then the sugar is going to act as a magnet for water. Now, diabetes insipidus. What is diabetes insipidus? This type of diabetes, it has got nothing to do with blood sugar. This diabetes is having a problem with ADH. That's our antidiuretic hormone. And somebody might ask, what's the job of ADH? The ADH regulates body water balance, which means that it tells the kidneys to hold on to water. If ADH is missing or not working, the kidney is not able to hold water. Therefore, the kidneys dump the water. This causes massive amounts of dilute urine coming out. That's going to cause extreme thirst. And one tip I want to throw in here is, in management of a patient with this condition, you are trying to hydrate the person as possible as you can to avoid dehydration. Okay, lovelies. So that was the difference between diabetes mellitus and diabetes insipidus. See you in the next video. Like, share, and comment. Bye.